I really wanted to make sure that if someone's going through cancer, we start to remember that they're a whole person. And it's not just the cancer we're dealing with their lifelong health. And we don't want to forget about that for sure. I think it is really important in survivors, especially to get a realistic overview of where are you at right now with your heart attack and stroke risk. When it comes to managing your heart health, it's very multifactorial. It's not just cholesterol. It's really blood sugar and stress and sleep and this whole body approach to health. This is what functional medicine is all about. This is what we're all about when it comes to supporting someone with reducing cancer recurrence risk, and it's also going to help with your heart too. Cardiovascular disease is actually the number one cause of death in North America. Cancer is close behind that, and the problem is, and what we're going to talk about today, is how people who have gone through cancer have an even higher risk of having a cardiovascular event. So not only is the general population in North America, which is typically what we're supporting, although we do have people worldwide who have come to work with us, but generally speaking, the number one cause of death in North America is heart attacks and strokes. The second would be cancer. So now you've gone through cancer, we also want to make sure that we're looking at your heart health and your cardiovascular disease risk too. The thing is that people who have gone through cancer treatment, so chemotherapy, radiation, immunotherapy, hormone therapies, these all have an impact on your cardiovascular disease risk too. So they're going to increase risk even more. So we got this baseline risk already, just being a person in North America, for example, where the number one cause of death is cardiovascular disease. And then you've also gone through cancer with the cancer treatments, increasing your risk even more. We really want to make sure that we are focusing on your heart health just as hard as we are focusing on your recovery after cancer and keeping cancer away. It's really, really important, something that is really bypassed, and that's what I want to fix. I feel like it's one of my big motivations with doing what we do is not only are we working on helping someone to feel much better after treatment and helping them to reduce the risk of cancer coming back through these nutrition, lifestyle, whole body approaches, but we're also helping their heart and working on this other potential increased risk for disease and death too. So, and the nice part is a lot of what we do for cancer recurrence prevention is going to play into heart disease prevention too. Pretty great. So just saying that not only do we want to focus on the cancer and keeping cancer away, we want to make sure that we're looking even further than that when we're supporting you post-treatment and even nearing the ends of your treatment. We really want to be looking at, is your heart also supported too? Because we don't want you to survive cancer just to fall to cardiovascular disease events or something like that too. So that's what we're talking about. And I just want to say, I am very, very, very conventionally minded. We do, myself, my team, we do very much believe that chemotherapy, radiation, hormone therapies, immunotherapies, all these conventional treatments are drastically needed and they're very important. And that's not to say that you're a bad person if you did choose not to do them, but this is just typically how we practice is we will encourage these conventional treatments where it seems to suit the person best. We will never push it. We will educate. We will kind of give you the details and help to answer any questions you might have around fears and things like that. We'll respect your decision, but I'm not one of those naturopathic doctors who believes we can do everything just with nutrition and supplements and stuff like that. I do believe that you have to go potentially pretty hardcore in order to do that. I believe we have higher success rates when people are following most of the conventional guidelines too. So that's just my personal practice. Again, I'm not saying anyone's a bad person if they don't agree with that, and you can still continue to learn from me if that doesn't resonate with you. But typically that is how we practice. So me saying that people who get increased risk of cardiovascular disease because of these treatments is not me saying you should not receive chemotherapy, radiation, whatever it might be. It is me being realistic about being stuck between a rock and a hard place sometimes. You do have to choose these conventional therapies that can be very rough on the body in order to combat the cancer for sure. And no one's going to deny that these therapies come with side effects. Conventionally, naturopathically, whatever it is, we know that these therapies come with side effects. The thing that we need to work harder at and do better at in medicine is helping someone to manage these side effects to reduce the chances of these side effects happening. So we don't typically work with people who are in the beginnings of treatment. We typically work with people nearing the middle end and then have completed treatment. But my colleagues will support you if you're just starting treatment with How do you reduce the risk of these side effects even happening, getting you through the treatment better, things like that. But our role and what we like working on is like, if you are undergoing certain chemotherapies that are going to influence the heart and maybe cause damage, what can we do preventatively? If you already finished treatment and we're looking at long-term prevention, what can we do for everything, like digestive health, but particularly we're talking about today, what can we do for your cholesterol? What can we do for just overall improving the heart muscle function, things like that. So functional medicine really shines when it comes to side effect management and chronic disease management, chronic disease being cancer, chronic disease being cardiovascular disease. And today we're really going to talk about, basically this episode is for any of the women who not only want to look at preventing the chances of cancer coming back, but really want to live a long life in all ways, including managing side effects from treatment and your risk of heart attack and stroke. And that's what we're focusing on today. So yeah, so cancer treatments, rock hard place. You sometimes have to do them and they serve a very important purpose. But now we're looking at the damage that is often caused to like blood vessels or the increased inflammation. A lot of these conventional therapies can also alter your cholesterol transportation and increase cholesterol. They can disrupt blood sugar regulation. They can accelerate the aging of your blood vessels, all increasing your risk of having a heart attack or stroke down the road. The other thing is that hormone meds like estrogen, when we have estrogen circulating in our body, it's very important for supporting the health of blood vessels. It helps to influence cholesterol metabolism. It helps to influence healthy inflammation, like resolve inflammation. And then whenever people are going through any sort of cancer treatment that suppresses estrogen, which pretty much the majority of the clients that come to work with us, they have had a breast cancer diagnosis or anything hormonally or female related where their hormones are impacted. So whenever we're going through cancer treatments that are suppressing their estrogen, we're seeing accelerated heart aging, cardiovascular aging. We're seeing higher bad cholesterol, LDL. We're seeing insulin sensitivity problems because whenever we're suppressing estrogen, we're not getting a lot of the positive impacts that estrogen typically has in the body. Again, rock and hard place. And it's not just medicine. We have rock and hard place conversations. Rock and hard place conversations happen all the time. These are just more serious conversations too, and a little bit more scary. So again, conventional therapies, we have to do them more often than not, but we can also do more to support someone's body so that the impacts are lessened and the long-term impacts are managed and also lessened too. So I really wanted to make sure that if someone's going through cancer, we start to remember that they're a whole person and it's not just the cancer we're dealing with their lifelong health. And we don't want to forget about that for sure. All right. So what we're going to talk about today, it mainly a lot of investigations to see where do we need to focus our time and energy, like how do we choose specific nutrition, supplements, things like that in order to improve cardiovascular disease risk. And basically the goal is to teach you how to protect your heart. I did already do an episode on bones already. I've already talked about blood sugar regulation. I'm going to link to those in the show notes because we know that conventional treatments also have an impact on bones. And also I'll talk about how blood sugar regulation is highly linked to heart health too. But I'll put all that in the show notes. So I'm going to talk about these known risk factors for cardiovascular disease, which you might already know about. I'm going to just very briefly touch on them. We're going to talk about nutrition, exercise, stress reduction. I'm going to get very into the nitty gritty of blood work and some supplements in order to help improve your heart health and help yourself now and in long term. So let's start by blood work because it's my favorite thing to dive into. I love data. I love blood work. And we're going to start with just the standard cholesterol panel, which pretty much anyone can get ordered. You just go to your doctor, you say, can I get a cholesterol panel done? And they're going to order for you total cholesterol, triglycerides. You're going to be able to see your LDL, which is your bad cholesterol. You're going to be able to see your HDL, which is your good cholesterol. They're going to give you a couple of ratios. That's all well and good and a very good starting point. We absolutely do need that information, but there's more to it. There's more to the story that is missing. And there are, I think that there's 3. I'm just checking my notes. Yeah, there are about 3 markers I want to focus on today that you have to ask for typically extra to what anyone would run as an oncologist or general practitioner to check your heart. The first one being ApoB. APO, and then the big letter B. This is something I want you to ask your doctor about. This number is another blood work marker. This number reflects the number of particles that will carry cholesterol that can end up blocking the arteries and causing heart attacks and strokes. So it's an extra layer of information that might even be a better predictor of cardiovascular disease risk than just looking at like your cholesterol panel and LDL on its own. So it's a little bit more accurate. If it's high, it's a greater chance of having a blockage leading to heart attack and stroke. So let's see where that is at. Very simple. Just look at your ApoB. And the other part is lipoprotein little a. So lipoprotein, and then in brackets, it's just a little letter A. This is very much genetically driven. So it gives us a little bit more information on how great of an impact will diet and lifestyle have on influencing your cholesterol and your risk of heart attack and stroke. If lipoprotein A comes back high, typically that is because it's a part of your genetics, and it is very hard to change that with nutrition and lifestyle. Now, that doesn't mean that nutrition and lifestyle absolutely are not important and it's just your destiny now. You now have high lipoprotein A, it's genetics, there's nothing you can do about that. That is not what that means. It means that it has a lesser impact, not a zero impact, and you need to be better monitored, essentially, is what we're looking at here. You might potentially have to do further testing, like a CAC test, which is like an artery calcium score that we're looking at, just to see how much further has the disease progressed. And it's just a better tool to monitor for your long-term health. You just have to be followed more carefully, more regularly, if your lipoprotein A is high. There is still information out there showing that having good nutrition and good exercise routines will still help to reduce heart attacks and strokes if you have high lipoprotein A. It's just not going to be as impactful as if your lipoprotein A is normal, but your cholesterol panel is really high. If you change your nutrition and your exercise routines, maybe supplements, whatever it might be, then you have a drastically decreased risk of heart attack and stroke. In the case where lipoprotein A might be high, it might just be a slightly lesser risk of heart attack and stroke. So you only really have to test it once. I think it is really important in survivors, especially so you get a realistic overview of where are you at right now with your heart attack and stroke risk. So I really would encourage you to push this. This is actually kind of new information. Like, it's been around for a bit, but it's really being spoken about way more often in like the last couple of years, like 2 years maybe or less, where we're seeing more doctors testing this lipoprotein A because of the new research coming out. And I think mostly it's because they're starting to create some drugs to target this particular molecule too. So as you see more drugs being developed, you're probably going to see it come into conventional practice a little bit more. I'm just going to put a little bit of like, I don't know, this would be angst, I guess, where I feel like naturopathic doctors and functional doctors are always on top of things. And then all of a sudden, now it's the conventional doctors say like, oh, did you hear about this? And we're all like, yeah, we heard about that a long time ago. We've actually been testing that for a while. Like, for example, like the food pyramids and things like that, especially in Canada. We're like, we've always kind of pushed a lot of those things. And then all of a sudden, a couple of years ago, they changed the food pyramid to be like more legume heavy and stuff like that. I'm like, yeah, obviously we've been pushing that for a while. But that's just like, we've been looking at lipoprotein A in functional medicine for years. It just takes a little bit of time for it to become the conventional standard of practice because they have a lot more guidelines and red tape to go through for sure. But yeah, we've been looking at the research and testing this for quite some time. So just to kind of recap those, you're going to look at your standard cholesterol panel. You're going to add on an ApoB. You're going to add on a lipoprotein A. So just kind of getting into the lipoprotein A, and I was just kind of touching on how there's some medications now that are currently being made for lipoprotein A. So if it comes back high, again, like I said, diet, lifestyle may not touch that. Supplements may not touch that right now. It's still important, but it might not change it drastically. So that's why they're developing these medications, because even statins, like the standard conventional medications that are typically prescribed for high cholesterol, don't often touch the lipoprotein A either. It can still potentially show some benefit, but we need better drugs, and that's what they're developing. I'm not saying everyone needs to go on these drugs. I'm just kind of telling you all the information out there that you can discuss with your medical doctor who can prescribe them for you if you want. But there are some promising therapies in development to target the lipoprotein A. So even if you do have a genetic predisposition, there might be some medications developed very, very soon that can help to lower that and, again, lower your risk of heart attack and stroke. So if you do come back with high lipoprotein A, one, you got to bring that to your doctor. You got to be more closely monitored, and then you should be notified right away whenever those medications come out, depending on how everything else looks in your whole picture of health and what we're talking about today too. So you might be a higher priority if a lot of the other things that we're going to talk about might be high and increasing your risk too. So, let's go back to testing. So we did cholesterol panel, we did ApoB, we did lipoprotein A. Now let's talk about kind of an inflammatory marker, hsCRP. Very easy to get done as well. It's probably something your doctor might already be ordering if they're already looking at your heart health, but high sensitivity C-reactive protein, hsCRP. This is just telling us how much inflammation is in the body. Particularly, it's more like sensitive. It's kind of like more directed towards the heart health. And if you have a lot of inflammation, it's going to relate to increasing one's risk of heart attack and stroke, because inflammation can cause the plaques. You may have heard of plaques, but basically like the things in the blood vessels to be more unstable. It causes them to kind of loosen up and then travel and be more prone to causing blockages in the smaller vessels where we don't want that to happen, leading to the heart attack, leading to the stroke. So high inflammation alongside high cholesterol, very big priority to managing that, because you're going to be at an even higher risk of heart attack and stroke. The other thing is a little bit more functional medicine, a little bit more add-on, because we can influence it from a functional medicine perspective, where we're looking at nutrition and potential supplements. And this is the omega-3 index. We can see the EPA and DHA, which are omega-3s, as a total, as a percentage of the total number of all the different types of omegas, because there's a bunch of different types of omegas, fatty acids, in the blood, in the membranes, essentially. So it's telling us how much of the good omega-3s do you have, and we can use diet and potentially supplements in order to improve that, because someone with bad ratios of EPA and DHA compared to the total omegas will be at an increased risk for cardiovascular disease events as well. So again, that's a little bit more functional medicine. It's likely not something that your medical professional could order. Potentially, if you have a cardiovascular specialist, they might look into that for you. But I would say it's not really one of their main tools, because they're not often the people who are managing your nutrition and supplements and stuff like that. So that's why it's a little bit more of a functional medicine approach, where that is in our tool belt. It's the nutrition and the supplements that are in our tool belt in order to influence that for sure. But yeah, you also want RBC, red blood cell, omegas numbers, not the serum numbers. So sometimes you go to order it, and I know on our end, you can choose RBC or serum, and RBC is what we're really looking at, the red blood cell omegas. That's what we're wanting to see. We don't want to see all the circulating omegas in the bloodstream. We want to see what's in your red blood cells, okay? So those are the cholesterol markers to add on in order to better assess your cardiovascular health. Now I want to talk about blood sugar. Again, I won't talk about it too much. I will refer you to other episodes that I've done on blood sugar. But the reason we want to consider blood sugar regulation in a heart health episode is because blood sugar, whenever it's dysregulated, it causes damages to the blood vessels. It increases just basically oxidative stress, again, leading to more damage. It can worsen the behavior of the cholesterol particles, causing inflammation around the plaque, causing them to unlatch from the blood vessel, causing them to build up even bigger in the blood vessel, whatever it might be, and essentially leading to blockages. We don't want that. It is a major driver of heart health. I feel like it's often forgotten about, and people are just kind of focusing on cholesterol. But in terms of the whole picture of heart health, we cannot forget about blood sugar regulation. So important. And not only is blood sugar regulation important for heart health, it's really important for cancer recurrence prevention and optimizing someone's health post-cancer too. So what a nice little tie-in here, where you work on one, you're going to help the heart, and you're also going to help the risk of cancer too, reduce that risk. So I will put that into the show notes. Listen to those episodes on how to manage blood sugar. So just very quickly, some other contributors to heart disease. They're important, but you probably already know about them, or by managing your cholesterol, by managing your blood sugar, it's going to support a lot of these too. But if you're a smoker, if you have high blood pressure, if you don't move around a lot, if you have a very sedentary lifestyle, if you drink a lot of alcohol, if you have chronic stress, if you don't sleep well, these are all known contributors to heart attacks and strokes, and we definitely want to think about that and manage that as well. it's going to help your heart. It's going to help with reducing cancer risk too. So win-win there. It's not, I know it's just easy for me to list those out for sure, but I'm just kind of giving you the information here that you can start picking away at and working on. So again, like when it comes to managing your heart health, it's very multifactorial. It's not just cholesterol. It's really blood sugar and stress and sleep and this whole body approach to health. This is what functional medicine is all about. This is what we're all about when it comes to supporting someone with reducing cancer recurrence risk. And it's also going to help with your heart too. All right. So it's pretty cool. If you want to get to work on this, first you want to order that blood work we're talking about. So the blood sugar stuff that you'll learn from another episode, the cholesterol stuff and the add-ons that I talked about there, the inflammatory marker. You want to start working on stress and sleep and all those kind of things. But another little tool here that you can do, they have a lot of cardiovascular risk calculators online that you can go in and use yourself. The best way to use it really is to do this calculator alongside a health professional because it can be a little bit complicated. Sometimes it's hard to know what to do with the information, but just a good start if you want to go try it out yourself. It doesn't hurt. And you can literally just search like cardiovascular disease risk calculators and it'll come up with a couple. Our favorite is the Prevent. It's literally like the word prevent, PREVENT. It is a newer tool. It's a little bit more comprehensive. That's one of our favorites. The other ones we've used in the past would be like the Framingham risk score. But you go in online, you can add in everything from like, are you a smoker or non-smoker? Do you have high blood pressure? Do you already know you have diabetes or not? Do you have high HbA1c? Like all those things, it'll ask you questions about that, all the things that relate to your heart health. And you can get a risk assessment at the end to say, are you low, moderate, or high risk of cardiovascular disease? And that can just help to influence everything from like your motivation. So if you see that it's moderate to high, you might be a little bit more motivated to be like, yep, I really do need to make sure I go get my updated blood work. Or I really do need to make sure that I start meal prepping or sign up for that dietitian or the exercise class or whatever it might be. It really is a mindset switch. I don't want you to get that information, think that, well, I'm doomed, stuck forever. Not the case. It's definitely going to require some effort, which can be difficult as well. But simple, small changes can make a big difference from your heart and your cancer recurrence prevention perspective for sure. The thing about these tools is that they're not perfect. They definitely don't account for the fact that you've had cancer treatments. Like they don't ask about particular chemotherapies that might have increased your risk for heart damage. So that will be left out of it. Even like a lot of hormonal problems, early menopause, doesn't ask about like gestational diabetes. All these things can also increase heart attack and stroke risk. But it's okay. It's a starting point. The tool is really meant as a starting point. And then from there, we got to work on it. We're always should be working on our heart health no matter what, preventatively too. So even if it comes back low, we still want to be very motivated to make sure that it stays low. And your risk for heart attacks and strokes is always low. Let's now talk about how, like I didn't mention specific foods or specific supplements yet, because whenever we're supporting someone with making these changes, kind of like how I always talk about, you don't take supplements or you don't include foods to kill cancer cells. You don't take supplements or you don't necessarily take foods in order to lower cholesterol. You take supplements, you exercise, you choose certain foods to target the different ways that cholesterol is raised. So blood sugar, inflammation, the HDL versus the LDL, the good versus the bad cholesterol. If we need to target muscle building, if we need to actually look at cholesterol recycling and good gut health and good liver health, this is where you actually look at your numbers, so your blood work, your health history, all those kind of things, and think, this is potentially why my risk of heart attack or stroke is high. This is potentially why my cholesterol is high. Now I'm going to choose certain interventions in order to target those specific parts of what contributes to cholesterol being high. I don't just say, oh, it looks like you've got bad cholesterol and it's high. You should just take this bergamot because it's known to target cholesterol. No, you might want to take bergamot because it's been shown to target LDL in particular. Or you might want to take fiber because I noticed that your fiber is low in your diet. It's probably not contributing to your cholesterol recycling. So that's potentially why the cholesterol is not leaving your body. You have bad gut health, whatever it might be. Now you want to take fiber. Now you want to work on your gut health because that's going to improve the cholesterol recycling in the end. So it's multifactorial. It's never just like one lever you're going to pull. We want to approach this from many different perspectives. So, for example, when we're looking at choosing targeted nutrition, we want to look at, oh, looks like your blood sugar is dysregulated. So we're really going to focus in on protein, fiber, healthy fats at each of your meals and your snacks, because that's going to lower your blood sugar. It's going to regulate your blood sugar. It's going to lower inflammation. And this way, we're not going to hit any of the cholesterol plaques, destabilize them, cause this inflammatory reaction leading to heart attacks and strokes. And in the end, it's also going to contribute to your cholesterol being lowered as well. We do want to look at saturated fat, cholesterol, things like that for sure. But when we're choosing nutrition, there is research behind it, but we also want to think further than that and go, we need to target blood sugar. We need to target inflammation. We need to target tissue rebuilding because that's contributing to inflammation. We need to improve your gut health and target certain maybe fermented foods or different types of fiber in order to make good gut health, because that's going to help with the cholesterol recycling. It's just like taking it a little bit further than just, oh, fiber has been shown to decrease cholesterol. Let's see if there's other things we can target as well to help improve your health. But of course, good nutrition, appropriate exercise. We want to build muscle. That's going to help with blood sugar regulation. It's going to help to metabolize more unhealthy fats in your body and build more muscle that way. It's going to lower inflammation. This is how exercise helps with cholesterol. We want to help with stress, nervous system support. All these kind of things is where we're looking in order to make improvements. And then like if we're looking at specific supplements, again, I would give someone fiber if they show that they just don't eat a lot of fiber in their diet, as we're starting to work on foods that contain fiber. If they have poor gut health, we're going to work on that. Maybe if they have dysregulated blood sugar, we might give them berberine, and that could, in the long run, help to contribute to lowering cholesterol. These are just outside the box thinking strategies, as opposed to just saying, I read an article that says CoQ10 helps with cholesterol management. I'm just going to take CoQ10. It might not help you with your cholesterol management if the underlying cause is not a CoQ10 deficiency. In fact, CoQ10 is really only helpful if you're on a statin, because statin diminishes CoQ10, leading to those muscle pains and things like that. So it doesn't necessarily even help with cholesterol. It does help with heart health. It helps with the muscle pain, but it's not really going to move the cholesterol particles so much, right? So different things that you're going to come across might be a little bit confusing because they're meant for one reason why cholesterol might be higher, heart attack and stroke risk might be high, but it might not be your reason as to why heart attack and stroke risk might be high. Okay? So just to give you a little bit of a takeaway here, blood work helps to become more focused and more targeted with your nutrition, your supplements, your lifestyle, whatever it might be. It can also help to motivate you. A lot of times, if you don't even know if you have cholesterol problems, why would you start working on your nutrition? I've had many clients who we've done their cholesterol, they see that it's high, and then that's like the kick in the butt that they need it in order to actually get down to work and start making some changes for sure. And then you use those numbers to, one, decide what to do, but you also use those numbers to reassess and see, did whatever intervention you apply actually work for you, which is very important as well. We want to make sure that we're getting a little bit more confidence in whatever you're doing is working, not just guessing. We want to recheck down the road. So you do your initial baseline testing, apply an intervention, and then we're going to test again down the road to see, did that actually work? And the other thing too is whenever we support someone with their heart health, it's also going to help with your risk of cancer being reduced too. They really are not separate plans. They are really very much integrated into one strategy. And it's not like you have to add in 100 million different things. If we can understand everything from blood sugar regulation to inflammatory levels, targeting that's going to help your heart. It's also going to help reduce cancer recurrence risk too, because I discussed that ad nauseum potentially in other episodes, how if we can regulate someone's blood sugar, if we can regulate and lower someone's inflammatory levels, that's going to contribute to reducing the risk of cancer growing, starting, being fed, all those kind of things. And it's going to help with your heart health too. A lot of overlap here. So that's what I had for today. I will do potentially a specific episode on nutrition, exercise in the near future. I have nothing exactly planned yet, but I definitely would like to get some experts in on that. But as it stands, your first steps here are to get your blood work done, go a little bit above and beyond, and to get a little bit more specific, and then start seeing what needs help, what looks really good, and target your nutrition, supplements, your whole body strategies based on whatever your data points are from there. Okay? So I hope that was helpful. Thank you very much for tuning in. And here's to you flourishing after cancer. Thank you so much for joining me today on the Flourish After Cancer podcast. If you loved this episode, please be sure to leave a review and subscribe so you never miss an episode. Sending all my best your way, Dr. Megan.